In many countries, a large proportion of patients do not follow their prescribed treatments. This leads to poorer health outcomes and significant cost for healthcare systems. At the same time, social media has become a key source of information. Influencers in particular have strong relationship with their audiences. So, can they help change patient behavior and improve patient adherence to medical treatments? To answer this question, we conducted a quantitative study with 475 participants. We focused on Instagram influencers and examined how their characteristics influence treatment adherence. More specifically, we looked at three key dimensions: their social attractiveness, meaning how relatable and likable they are; their perceived authenticity, meaning whether they seem sincere; and their perceived expertise, meaning whether they appear knowledgeable. We also compared different types of messages, emotional versus more rational ones. Our results show that influencers can indeed play a positive role. When an influencer is perceived as socially attractive, people are more likely to follow their recommendations. But this effect is not direct. It works through two important mechanisms. First, authenticity. People follow influencers they perceive as genuine. And second, expertise. They are more convinced when influencers appear competent. We also find that emotional messages are particularly effective. They create stronger engagement and reinforce the impact of influencers on behavior. These findings have important implications. From a theoretical perspective, they highlight the role of social and psychological factors in health behavior. From a managerial and public policy perspective, they suggest that influencers can be valuable partners in health communication. They can complement traditional approaches, which are often more top down and less engaging. However, this also raises important challenges. Not all influencers are credible, and misinformation can have serious consequences. So, the key is not just to use influencers, but to collaborate with the right ones, those who are authentic, knowledgeable, and responsible. In conclusion, social media influencers are not just marketing tools. They can become powerful actors in promoting better health behaviors if used carefully.